Et il est temps maintenant déjà, j'ai envie de dire, de clore cette conférence très dense depuis ce matin. Et pour ça, je vais laisser la place à un acteur essentiel, incontournable dans notre domaine, c'est l'Organisation mondiale de la santé. Nous avons l'honneur et le plaisir d'accueillir ce soir monsieur Derrick Muneene, qui est chef de l'unité de renforcement des capacités et de collaboration en matière de santé numérique à l'OMS. Voilà, je lui laisse la parole pour la conclusion de cette conférence. Voilà, Derrick Muneene, représentant de l'OMS ce soir à Toulouse et en direct. Voilà.
Well, good afternoon.
Okay, I repeat. Thank you so much, Lionel. Checking if the microphone is okay. All right. I will speak in English, but wanted to maybe begin by thanking the organizers, more specifically to just recognize the tremendous support that Beatrice and the Foundation and the other organizers have provided towards organizing such a robust event. And I would also want to thank the moderator, Lionel, excellent moderation, tremendous meeting, and definitely I believe that you all agree that this has been a tremendous meeting. Why don't we give an applause to all the participants, the organizers, and the speakers. Now, my task is very simple. It also includes holding the microphone properly. We're excited as the World Health Organization to be part of this event. More also because we are partly in the midway regarding the implementation of the global strategy on digital health, 2020 to 2025. The discussions we've had today are the heart of that resolution. In the morning, we discussed key issues around the enabling environment, around assessments, issues of scalability, topics that have been with us for the past 20 years. And then in the afternoon, we engaged in discussions on capacity building. How do we ensure that the transformation that we speak about, the fourth industrial revolution, leaves no one behind, both the people and also the actors that are involved in using the digital solutions that we speak about. We're thankful because this discussion could not have come at a very timely time because, as you know, the COVID-19 pandemic has both challenged health systems, brought about tremendous opportunities of digitalization, and at the same time has promised a future that is characterized with digitalization. Indeed, the new normal is actually digital. And as Dr. Tedros, our Director General, once mentioned, the future of health is indeed digital. And what we call digital health, or e-health today, in times to come, is more likely to be referred to as simply health, delivered by digital means in a digital space. I would like to emphasize 3 words that came out today. And these promise a better transition into the new normal for scale. These are scalability, sustainability, and also systems thinking. Tremendous projects have been presented. Thank you to all the presenters and all the projects. We must continue to think system-wise so as to avoid the challenges we've had in the past decade or two, which were characterized, as was mentioned from Bangladesh, on verticalization, digital solutions focused on programs. But really transitioning towards thinking system-wise, and at the same time thinking for the future, and as participants mentioned, designing testing assessment as an integral part of these interventions. To do this, international collaboration, international actions, and coordination on the part of all is essential. And that is why our global strategy on digital health is formed on 4 principles. Principle 1, focusing on collaboration as we are seeing here. And principle or objective number 2, focused on integrating actions in national strategies. And then thirdly, principle or objective number 4, really focused on governance, making sure that the cognitive capabilities to manage systems are established within the civil entities, governments, academia, including the private sector. And then lastly, the people we're describing, patients, health seekers, ensuring that our interventions put people first, which is objective number 4, patient centricity. Digital health and e-health exist because of the promise and aspiration of bringing about better health and well-being of the people. The discussions we've had from the morning to now is simply because we're aspiring to use ICTs to improve the health and well-being of the people that we're serving. And that is why we're pleased that we're able to participate actively and we're able to indeed contribute effectively to this particular session. It's been very effectively conducted and being in person is much, much different than virtual connections. And so we hope next year we'll be able to meet also in person. We hope next year all the people that were speaking virtually will be able to join us in person. And as we strive for universal health coverage, leaving no one behind, let's make sure that we leave no one offline. Merci beaucoup and thank you very much everyone.
Merci beaucoup Derrick Muneene de cet enthousiasme et de cette conclusion qui nous ouvre de nouvelles perspectives, pas seulement jusqu'à l'année prochaine, mais effectivement pour le futur, les prochaines années. Toute dernière personne à venir clore pour cette conférence, pour cette journée, celle qu'il a ouverte ce matin en lieu et place de Béatrice Garrett, Chose France. Béatrice, si tu nous écoutes, j'espère que ça va beaucoup mieux déjà ce soir. Et pour clore donc cette conférence, nous rejoint Solène Barbe, directrice des programmes de la Fondation Pierre Fabre.
I hope she's feeling much better. So thank you for being here with us now and for closing this session you have launched this morning.
Oui, c'est bon, pardon, excusez-moi. Oui, merci beaucoup. Du coup, je pense que je crois que la journée a tenu ses promesses, que ce soir, tout le monde repart avec quelque chose en plus. Je pense également que c'était une journée très riche en échanges. Merci, je rejoins évidemment tout ce qui a été dit, les remerciements à l'attention de Lionel, de la qualité de la modération, avec beaucoup d'énergie et d'acuité. Tous les participants, évidemment, les conférenciers, les personnes qui sont connectées partout dans le monde. On espère que ça a été agréable de suivre aussi à distance comme ça l'a été dans la salle. Je remercie évidemment toute l'équipe technique pour avoir assuré le duplex et puis les connexions sur les campus de l'AUF, les traducteurs et puis évidemment l'équipe de la Fondation Pierre Fabre et en premier Léa Mattel et Maxime Collin qui sont les organisateurs, les chevilles ouvrières de tout ce travail-là et toute l'équipe derrière aussi qui a assuré toute la logistique, vos déplacements, etc. Voilà, donc c'est avec un grand plaisir qu'on espère vous retrouver l'année prochaine, bien sûr. Et puis, il y a un rafraîchissement qui vous est offert dans la salle à côté pour continuer les conversations si certains le souhaitent ou en attendant vos transports pour rentrer. Et puis, je vais demander aux conférenciers intervenants de nous rejoindre sur la scène pour la dernière photo de famille. Voilà. Merci encore à tous et à toutes. Et puis, j'espère à très bientôt.